Generic drugs can be lifesavers for people in need of medicine. They cost less than the name brand drugs, but they're just as effective and they're FDA approved, which is why insurance plans tend to steer patients to them for that reason. Joining us to discuss why the need for generic drugs has never been more important is the president and CEO of the Association for Accessible Medicines, Dan Leonard. All right, Dan, I just touched on it there in the intro. Why are generic drugs so important and how frequently are they prescribed?
Thank you, Curtis. Great to be here. And there are indeed, as you said, more important than ever. The cost of healthcare in general has been going up steadily over time. The only component of healthcare where the price goes down over time is when a generic medication or multiple generics come onto the market to replace a branded medication, and you will see significant savings. So the percentage of prescriptions filled in this country in 2019 was 90% generic. So 90% of the scripts filled in the U.S. were for generic medications, yet they only take up 20% of the overall cost of drugs in this country. So that's a huge statistic right there, and that's a savings to U.S. taxpayers of about $313 billion in 2019 alone.
Wow, those are big numbers. That's what I was just going to ask you. It was the financial benefits for these drugs to the actual patients, because that's what we care about here.
Yeah, and I'm glad the conversation is going in that direction, because sure, $313 billion is a big number. What does it mean to the patient at the pharmacy counter? Well, you think about the copays, and sometimes if you have a new prescription for a branded medication, you'll get some sticker shock if you go to the counter and see a copay. The average copay for a branded medication is about $60. The average copay for a generic medication is $6. So again, significant savings. When more than one generic comes onto the market, say 4 or 5 generics come onto the market at one time, you will see a drop of about 90 to 95% in the overall cost of that medication.
That graphic with the price difference was shocking. Let's keep going here. The generic drugs being used to treat, how are the drugs being used to treat COVID positive patients, and are they saving lives?
Well, absolutely. And if you think back to the spring when this pandemic hit, and patients were getting ill and going to the hospital, and physicians on the front lines, physicians, nurses, PAs on the front lines were trying to figure out how to treat this new virus. And what they did, in most cases, is turn to traditional, reliable, affordable generic medications to help those patients out. So among the sickest patients with COVID-19, sedatives, steroids to reduce lung inflammation, those are now being used in hospital settings around the world.
Well, let's follow up there is how much of our healthcare system savings can be attributed to generic drugs?
In 2019 alone, as I mentioned at the top, about 90% of the scripts filled are generic, delivering savings of about $313 billion overall to U.S. taxpayers and the system. In the government program specifically, so in Medicare, the savings was close to $100 billion, and in Medicaid, the savings was close to $50 billion. So right there, that's a significant savings, whether you're a retiree or you're in a Medicaid program, you need those savings associated with generic meds.
Appreciate your time today, Dan. Where can our viewers go to get more information about this?
So the report that I cited, in addition to information on what our companies are doing around COVID-19 treatment, can all be found on our website, and that's www.accessiblemeds.org.
Thanks for your time, and folks, we'll put this on the website. You can check it out again at firstcoastliving.net.